Good evening. I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump. And tonight, we were kind of joking before the show, if you don't see the call-in number, then you probably know it's recorded. But this is a live show. 727-8750 is the call-in number. And then my engineer producer tells me that if you see the TV rating thing on the upper corner, then that also means that it's probably a rerun show. But we're trying to keep a string going. But unfortunately, that streak will probably end on the first week in April. I will probably be out of town, so there will be some reruns at that point. One of the things I want to correct that was mentioned in a previous show, I think Louis had asked a question about vitamins, and so I wanted to go over the fat-soluble vitamins versus the water-soluble vitamins, and A, D, E, and K. K is a fat-soluble vitamin, and A, D, E, and K. The reason K is very important is because if you're on Coumadin and warfarin, K being a fat-soluble vitamin, lives in basically these are not digest, they travel through a different system, the lymphatic system, and not necessarily through your blood system, so to say. So fat-soluble vitamins tend to stay in your system longer. So for those people who are on Coumadin and decide that they want to eat green leafy vegetables, they actually have this, that's why it makes it really hard to predict your INR, which is a term for international units, when we do your PT and INR, to determine how the medication is being effective for you. Every one of a drug has what they call an LD50, and what that means is it's a lethal dose 50. I know it sounds kind of crazy, but lethal dose 50, and what that means is that at X dose, 50% of the population will die when they exceed or take that dose. So that's a very, and that curve, as we increase the dosage of a drug, we're all of a sudden, so if the slope of the curve is very slow, then that drug is very, very safe. Almost you will never reach the lethal dose 50. For a drug that has a curve that kind of goes like this, that's a very narrow therapeutic index, okay? That basically is a drug that you exceed the dose 50% of the population, and the higher the slope, the more dangerous the drug is and the narrower the therapeutic window. And that's very true for Coumadin and warfarin. We have Ray on the phone. Ray, it's very good to hear from you tonight.
Hey, yeah, Reiner Flagman here.
Yep.
I got a little story for you, Doc.
Okay.
I'm never going to trust the pharmacist again. I took some levofloxacin, and he told me, he says, take it at night before you go to bed because it makes you dizzy. And I had tried it during the day, and it made you a little dizzy, but it was okay. So I listened to this pharmacist, and then after 3 hours, I wake up and I can't sleep the rest of the night. I don't know if there's something in it or whatever. And I did it for 7 nights in a row, and every night I only got 3 hours sleep. So never again am I going to listen. I'm just going to do it like I feel is best for me. Because it was kind of funny. I'm saying, geez, I'm losing sleep because I'm taking a medication.
No, well, Ray, that drug it does what it's supposed to do. It does keep you up.
Well, I didn't know that.
Yeah, and I don't know, because that's one of the major side effects of Levaquin or all the quinolones, is that they have a stimulatory effect on people. So when I tell people to take a BID drug like ciprofloxacin, I tell them don't take it past 4 o'clock in the afternoon or you'll be up all night. So.
Well, I found out the hard way, and I kept taking it. I should have just said, look, I'm going to go back to like 10 in the morning after I get to court, because you're a little bit dizzy, but I'm sitting in a courtroom anyway.
Yep.
But I just did it 7 days in a row, lost 7 nights of sleep, and I said I learned my lesson. Well, my question tonight is, I take aspirin every day, and is it true that aspirin really can help when you're having a heart attack? Mm-hmm. And when you do take it, you don't swallow it. I believe you're supposed to keep it in your mouth, much like nitroglycerin would go under your tongue. Doesn't the body absorb it quicker if it's in the mouth than if you swallow it and wait for the stomach to take care of it? And I'll open the line up and I'll call you later.
Okay, sounds good. Very good question. Yes, as a matter of fact, aspirin, most people don't have beta blockers, but if you go to the emergency room and they're going to ship you off, they will give you aspirin, and they also will give you a beta blocker to reduce the work of the heart. Because if the heart is under stress because of the heart attack, if they can slow the heart rate down and slow the contractile function of the heart, then you indeed can maybe preserve muscle tissue and reduce the effects of the heart attack. Aspirin is an antiplatelet drug, so basically once aspirin comes in contact with the platelet, it renders that platelet inactive or unfunctionable for the rest of that platelet's life. So that's why you take it every day. Your body makes platelets every day. It's one of the most rapidly turned over white blood cells in our system. Normal platelet counts are around 450,000 to 150,000 to 450,000. That's usually the normal platelet count for the average individual. There are conditions where your spleen gets too large and you have what they call thrombocytopenia. They sequester or eat up your platelets. You have other blood marrow disorders that will cause your body not to make enough platelets. And it is one of the things that we look at when the first thing to go in some type of leukemias or some type of bone marrow disorders is the platelet count. It's because it's such a rapidly divided cell. You can have too many platelets, and that situation is usually not as ominous as having too low of a platelet, but you don't really run a risk of bleeding until your platelet count runs below 50,000. A lot of times today when you get your blood checked, all your cells are thrown through what they call Coulter counter. Basically, it's an electrical grid that measures your cells' electroresistance as it goes over a screen. This is subject to a lot of inaccuracies, but it's relatively accurate. But people whose platelets can clump together register low platelet counts, and they have to be manual seen. So that's what aspirin does. It works on a thromboxane thing, and it basically is inactive. And yes, it is true that when you take aspirin by mouth, if you take it in your stomach, it has to be absorbed. It has to go through your small intestine, then it actually has to goes by the liver, and then it will do what it needs to do. Some medications are absorbed through the sublingual route. It bypasses the liver and bypasses the first pass to the liver, which means the liver degrades all of those medications, and some of that gets through. So yes, probably 325 milligrams if you were trying to render your body or help yourself in a heart attack situation. And aspirin's effects on the stomach locally are very devastating, because aspirin is, as you know, a salicylate or a salicylic acid molecule. And so what happens is it hits the acid in your stomach and then turns neutral. The acid neutralizes it and turns it into a neutral compound. And that allows it to go into the gastroparietal cell, and there the pH in the gastric cell is now alkaline, so now it becomes an acid again. It goes from acid to neutral back to acid, and enough of those molecules are inside the parietal cell of the stomach, then the stomach cell will become acidic and it will break open and lyse. So this is how ulcers are formed, through direct contact with an aspirin molecule. So if enough aspirin gets absorbed locally, I mean, they've done some experiments where they'll take just a stomach tissue, they'll cut it open, they'll put an aspirin on there, and it just basically burns a hole right through the stomach. So it basically is a very devastating thing. But your stomach is always moving, so it's unlikely. The enteric-coated aspirin actually has a coating on there that what it does is it protects it against the acid and until it gets into the small intestine, where it is then absorbed. The reason this doesn't happen in the small intestine is because the surface area of the microvilli of the small intestine are astronomically greater than what it is in the gastric cell. So while you may have one cell in the stomach absorbing 10 million so-called salicylate molecules, the average villi basically is this huge tube which has numerous cells, will probably absorb maybe 10, 15,000, not enough to alter the pH. But unfortunately, if that aspirin were to remain in the small intestine and get trapped and not moved, then it would do the same thing and would cause a duodenal ulcer, just because your body's pH is a little more alkaline than it is acidic. And so anything that has a strong acid would do that. So the long answer to your question was yes, aspirin is very useful in heart attacks. Do sublingual. If you happen to have beta blockers and you're taking those, then you should go ahead and do that. And it's probably always good to err on the side of being, if you're having chest pain and a lot of chest pain and you're not sure where it is, it could be gastric, it could be your heart. If it's just your stomach, put an aspirin underneath your tongue and possibly go to the emergency room where you can get better medical attention and you can make sure that you're not having a heart attack and maybe protect your heart and not get a lot of damage done to that muscle. The more you can protect, the better off. And clotting is a cascading process. So anytime you're interfering with platelets that are sticking in and accelerating that clotting factor, then you might be able to break that open. And there is a substance called TPA, which they give some people to help. They call clot busters, but very few people can take that. So we're going to go to break. And again, Ray, thanks for that call. And all your callers out there, please call back after the break. Thank you. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.